right, welcome everybody. Thank you so much for tuning into our presentation. So this is going to be key because I think you would agree with me that we've got a crisis in health in our country. Now, if I were to ask you the question, why are we in such a health crisis, what would be your answer? Maybe a lot of you are thinking, well, we're in a health crisis because we don't exercise enough. Or we have a health crisis in our country because of the foods we're eating. We may have a health crisis because of our lack of education. We've been marketed to by pharmaceutical companies for a long time, for decades upon decades. So maybe there's some misinformation, but we're going to cover all of those things because I know the reason why you're watching this is because you're looking for natural solutions when it comes to health, whether you're looking to get rid of that stubborn belly fat or have more energy or feel better in the morning or get rid of your depression or not feel like you can't turn off your brain because it's going a million miles per hour even though your body's tired. We're going to give you some natural solutions for these things today. I'm going to give you training. It's going to be a step-by-step training. And then I'm going to talk to you about how hormones, digestion, and stress all interplay with this thing that we call obesity or overweight. So as I go through this, I want to make two promises to you. The first promise is this will be the information that you're going to say, man, I wish my doctor would have given me this information a long time ago. You're gonna get better information than anyone before me has given you when it comes to an overview of your health. The second promise I'm going to give you is I'm going to give you the opportunity to take action when it comes to your health. So I'm not just going to leave you hanging. I'm not going to give you all this great information and then say, okay, good, keep watching videos, because videos can only take you so far. You actually have to start taking some steps on your own with a mentor to take action and actually change your health. So I'm going to give you those two things are going to be the key. And it seems like the only solution that they're offered is a medication. And so what we want to do is give you an idea, a better glimpse into the future of your health, because there's ways that you can do this in most cases without medication. I think we'd all agree that our bodies are designed to heal themselves as long as we give them the right environment. So what I want to do is give you some training tonight so you can take this home and start implementing it right away. And I'll give you the opportunity to take action where you can actually come in and see us and make some changes in your life with a group of very talented, caring individuals who will give you the right tools. So let's get started. Our goals for the day. The first thing we're going to cover is we're going to look at stress. So would you agree with me you've got too much stress? I mean, if you look at it, it's everywhere. We have people pulling us from our inbox. We get texts all the time. We're getting the IRS bills. We got whatever it may be coming at us, but stress has a massive impact on belly fat specifically. Now, the reason why is because if you look at the way our bodies are designed, from an evolutionary perspective, when we were stressed, that was because we were either A, heading into a time of famine where we didn't have food available, or B, there's a tiger chasing us, so we're trying to outrun the tiger. And so what our bodies do is we quit absorbing, we shut off digestion so we don't absorb nutrients. All we do is put those into fat cells to be stored for energy for the future, because it's a stress mechanism. So on your belly, you have 10 times more receptor sites for fat than you do anywhere else in your body. Now, why would you think it would be on the belly? Well, the reason why it's on your belly is because that's where all your organs and glands reside, is right within your abdominal wall. And so the organs need the energy first, because you can't live without a liver, you can't live without a heart. You can live without one kidney, but ideally you want both of your kidneys, but you need all your organs and glands if you're going to function optimally. And so the body, the reason why you put fat onto the belly is because those receptor sites are there designed to put fat around the organs so you can access energy quickly when you're in that time of famine. But in the modern day, we have food accessible all the time. We've never had the amount of accessibility to food as we have, in all times. I mean, our diets have changed more in the last 50 years than they have in the past 10,000 years. So we do have this this massive crisis in health, and part of it's due to stress. The other thing I'm going to train you on tonight is we're going to talk about hormones. Now, if you're a man and you're listening to this, you're like, oh, hormones, schmormones, but actually you need hormones. And it will hit you hard when you get later on in life and you haven't taken care of your health. That's when andropause sets in. That's where you start taking on female characteristics. You don't feel like yourself at all. Your testosterone drops, your estrogen levels rise, and you just feel pretty depressed and irritable and angry. So we're going to talk about hormones, but there's 3 particular hormones that I'm going to train you on. And if you can keep these hormones balanced and stable in your body, you will have 5 hormones that kick on to actually cause you to burn fat. So we're going to talk about those 3 secret hormones that will help get rid of this belly fat. The other thing we're going to do tonight is I'm going to talk about the cause of your health conditions, and then I'm going to put it all together into one piece. But if you look at diet and exercise in our country, there's a reason why they haven't worked. One of the biggest reasons is it's focused on weight, which is a symptom. And our diet recommendations, if you read most diet books, they're going to be very blanket based, and it's going to be really dependent on you having the strong willpower to actually overcome all these urges and desires to eat sugar and things like that. And so one of the things that I want to do is I want to look at this and I want to show you that getting rid of belly fat, transforming your health, is more about having a plan and more about having a step-by-step approach than it is about willpower. Part of why we have this health crisis is because we also have a crisis in health care. A lot of us have been taught to believe that we have a health care system. But if you look at the nature of the healthcare industry in our country, it's a $4 trillion industry. Now, that's massive. And if you look at the amount of money that people are spending on healthcare every year, the amount of money we're spending on average in America is $9,200 per person. Now, if you look at that, it's like, what are we getting in exchange? Well, from what the research shows and what I've seen, we're getting fatter, we're getting sicker, and we're generally becoming more depressed. Especially here in our state, depression's huge. So what we want to look at is, why is there this crisis in healthcare? And one of the biggest factors is that we have been given a lot of misinformation. And where does this misinformation come from? There's 3 major sources that I've been able to find. The first source is this misinformation that comes from the pharmaceutical companies. I mean, pharmaceutical drugs, when properly prescribed, kill over 100,000 people every year. Last year, according to JAMA, it was 106,000. Now, these are properly written prescriptions. There's no error. If you add in the errors from conventional allopathic medicine, we're killing nearly 250,000 people every year. Antidepressants alone kill on average 40,000 people per year. Now that's crazy, because automobile accidents kill between 40 and 50,000 people per year. So these are all preventable deaths. Now, when I finished my medical training, I took what was called the Hippocratic Oath, and that the first oath of a doctor is first do no harm. So you can see how there is a system that's built around a very dangerous medical model. And unfortunately, the medical schools are funded by the pharmaceutical companies, and so I am not by any way bashing on doctors. I believe in medicine. I'm not against medicine. But where I see medicine failing is in trying to address chronic disease in our country. Because 75% of deaths are attributed to chronic disease, as well as 75% of our spending. And one reason why it's so expensive is because we're putting money that needs to be used in other areas of health besides just drugs. But the second industry that I see is damaging to our healthcare system is the insurance companies. So why would I say that? Because you look at Obamacare, and now with Obamacare, you've got this cute little card. It's called an insurance card. And now we think, okay, I've got my health insurance card, therefore I'm healthy. The fact of the matter is, we have not gotten healthier since Obamacare came in. More of us are insured, But what that has done is insurance companies' profits in the last 5 years have gone up 200%. And your premium has gone up on average 69%. So you answer the question yourself. I mean, is that a problem? Because really, who's dictating the care when you go into your doctor's office? Is it you or is it the insurance company? Now, we dealt with insurance company for a few years, and what I found is that it was the insurance company who would dictate the amount of care that the patients were able to receive. And most of what your insurance company is going to pay for is surgeries when medically necessary. They're going to pay for pharmaceutical drugs. According to the CDC, 75% of all doctor's visits are drug-related or prescription-related. So they're going to pay for maybe some labs, but that's about it. Is your insurance company going to pay for you to get healthy or to be well? It's not, so it should not be called health insurance. It should be called sick insurance because it's meant to fix you once everything's broken. So we need to change the way we're thinking about health insurance altogether. But we've got pharmaceutical, we got health insurance. They're in the same bed. If you look at it, the hospitals are buying up all the private practices, and the pharmaceutical companies are in cohorts with the hospitals. So it's very damaging in our country right now. We're at a massive tipping point. So you've taken the courage to do something this is probably outside of your comfort zone by reaching out to us, by looking into some more functional medicine, some more holistic health care. The third thing that we have to confront when it comes to your health, the third piece of industry that's crippling us in the United States is the agricultural companies. The chemical companies like Monsanto's, they're spraying GMOs on all our crops. Over 90% of our corn in the United States is genetically modified. 93% of our sugar beets are genetically modified. If you look at wheat is genetically modified. When it's cut down, before wheat goes to get harvested, it gets sprayed with Roundup. And so what that means is it's like, well, yeah, we killed all the pests and the different weeds that could be, competing with that crop. But at the same time, there's the lack of diversity, and our bodies depend on a very diverse diet. So we're not getting that diversity, and when you spray Roundup on food, there's the active ingredient in that. It's called glyphosate. Now, glyphosate is like taking a broad spectrum antibiotic. What we're finding is that glyphosate is reacting with our sunscreen. So even though we use gallons and gallons of sunscreen, our skin cancer is going up. One of the reasons is because if you've got glyphosate in your body, it's reacting with the stuff that you're using to prevent the sunburn, because it's pushing the ozone layers, those ozone waves are getting deeper in your dermis layer, and so it's competing with that glyphosate and it's causing more skin cancer. Glyphosate, taking a broad spectrum antibiotic, also is going to destroy the good bacteria in your gut, which means we have more ulcerative colitis, we have more Crohn's disease, we have more autoimmune disease than we've ever had at any point in history. Part of that is from the glyphosate, because frankly, the foods that we eat in a lot of cases are not real foods. You go to fast food, it's not real food. You get something out of a package, it's not real food. You're not getting the same nutrients that our grandparents got. Our soils are depleted. So we have to watch out for those three things, because first thing, our insurance company, we cannot depend on insurance for our health anymore. Second thing is we cannot focus on waiting for that magic drug to finally come out of trials to save your life, because it's not going to. No doctor can heal you. You have to do it yourself. The third issue that we've got to confront is the food, the GMOs out there. They can literally wreak havoc on your whole system without you knowing it. All right, so number one disease in our country is heart disease. Over 611,000 people per year dying from heart disease. And that's in spite of having drugs that lower cholesterol, we have drugs that lower blood sugar, and we have drugs that lower blood pressure. All those things that we thought were causing heart disease are not actually eliminating heart disease. It's not even preventing it. So what we're finding now is, and I'm going to train you on this today, but we're finding that inflammation and autoimmunity has a lot more of an impact on heart disease than those other markers. Because yeah, it's important to get your blood sugar stabilized, it's important to regulate your blood pressure, it's important to make sure that you've got the health that you need, but it's not a medication that's doing it. The medication is suppressing symptoms, and we're still getting the disease at the other end. So that's one of the reasons why the British Medical Journal, what they said is 85% of all medical procedures and surgeries are scientifically unproven. Now, if you look at our health habits, how about us? Is there some things that we could do to be more proactive? Don't let me catch you doing this.